Well, we have a very important conversation right now, first at 4. Joining us is Dr. Shawn McCandless from Children's Hospital, Colorado. He is the head of genetics and metabolism there, and he's joining us today to talk about newborn screening. So thank you so much for being here, doctor. We appreciate it. We know that there are a lot of mamas watching, expectant mamas, and maybe even some expecting grandparents, new grandparents out there. So let's dive right in. What are newborn screenings and why are they so important?
Newborn screening is testing babies soon after they're born to find treatable conditions before there's ever a symptom, before anyone knows about it,
Sure.
with the goal of preventing death and preventing brain damage.
So what do they need to know about this process?
Well, it's helpful that when parents are aware that it's happening.
Sure.
On the other hand, it should be mostly behind the scenes to the parent. The baby in the nursery will have a hearing test. We'll have an oxygen monitor to look for critical congenital heart disease. And then we'll have a heel prick to get 5 drops of blood that will be sent to a laboratory, a state lab that does newborn screening tests to look for 35 or more conditions for which early diagnosis and treatment can profoundly impact the long-term outcome.
Sure, we always hear about how early detection is key and really anything. What happens then, doctor, when something is detected?
When something's detected, your primary care provider will be notified, and depending on the disorder, likely a specialist, either at Children's Hospital or somewhere else around the metro area or in your area, will be notified and will contact you to hopefully to give you the news, to provide reassurance
Sure.
that it's going to be okay, and to get you connected with the next steps, which is usually appropriate testing to confirm the diagnosis,
Right.
and, if necessary, to start treatment.
What's the percentage of the screenings coming back with a detection?
That's a great question.
Yeah.
It varies depending on which thing we're looking for, but it's probably on the order of 8 to 10% where there's an abnormality. Of those, 90% of patients or more babies will end up to be completely healthy with no problems. So that's why it's a screening test. Most people that flag on the screen are completely healthy and normal. It's the few percent where there's a problem. It's really, really helpful to know that early and get the treatment started.
Early detection, just like you said. Well, Dr. McCandless, thank you so much for being here. We appreciate your insight and information. And September, by the way, is Newborn Screening Month. And McCandless, she's going to continue our coverage as she's going to have many more stories about this important detection later this month. Mac.
Yeah, Kelly, so many important families are going to be impacted by that. Thank you so much.